It's about a smile. It's about kindness. It's about feeling each other's soul and feeling each other's heart and being engaged in a relationship with each individual patient, finding out what's important to them and just being involved in that. They need to know that they're being heard and they're being listened to. They need to know that they're a priority to us. Get more engaged with them. Find out what's important to our patients, to our veterans, so that they can be more successful.
Is today your birthday?
Yeah.
Happy birthday.
Thank you.
What a great day. 89?
89.
89, wow, fantastic.
The personalized health plan is really a great opportunity to change the way that we deliver our care completely. So instead of being medically driven, now we're more holistic in our focus. We've had a lot of positive feedback from our veterans. Some of the quotes that I can remember off the top of my head are, "I didn't know anybody cared this much about me," or "Even my wife doesn't care to know this much about me." So it's amazing that you all want to know, and then you want to offer me different ways to help me achieve my goals. Instead of being known as a condition or a disease, now they're known as what it is that they want to achieve in their life and how can we help them with it.
One of the main things was just actually sitting down and someone wanted to know why things were changing and what can you do if your careers are changing, your family life is changing, how to get better prepared because you have to take care of yourself. It really got me started and it showed that they really cared. The people here seem like they're part of your family.
It's what's known as a healing environment. And that's where, when our veterans come for care here, they feel as though they're in a place that supports stress reduction, a connection to things that are stress-free, quiet, calm, relaxing.
Well, good afternoon, Mr. Holder. How are you?
How are you, Nurse Diane?
I'm good. I just wanted to introduce you to our sleep menu that we have here available.
We offer a sleep menu to veterans, and we offer them items that we can give them in real time with a budget. It had to be sustainable. These were inexpensive CD player, warm blanket, aromatherapy. Now I think it's a great idea.
It's done wonders for me. Let me tell you, this is the best thing that ever happened to me since I've been here.
I'm excited to tell you about some of the patient-centered care features that we've implemented right here on 7C200. We believe that a healing environment is a quiet environment. And the Sound Ear is a visual reminder of our noise level. One of the features that we have in the room is a locked medication cabinet where the nurse or the healthcare provider can access medications specifically for that patient. Another feature is a bedside computer. Physicians, physical therapists, nurses can log onto the computers, review what orders that patient have, any notes that have been written on that patient. It also increases the time that the healthcare provider spends at the bedside with the patient. They can talk about what's in that electronic health record.
There are more than 6 billion cell phone subscribers in the world, an increasing number of people who have internet-enabled phones or tablets. Information, whether that's your banking information, your ability to order a burrito from your favorite restaurant, or your healthcare information is increasingly in the hands of patients where they are in their life spaces. The personal health inventory is really a way for us to capture a snapshot of what they desire and what their needs are, and really merge what I, as their doctor, realize needs to happen with what their desires are.
So packed, patient-aligned care teams most basically means that every time a veteran comes here, they'll hopefully have the same clinician, same nurse, same person checking them in, maybe the same pharmacist, and there's that continuity of care and the relationship building.
This also gives an opportunity to the staff to interact with each other, share the experiences they're having, so they can learn from each other as well.
It really comes down to the whole concept that we've talked about constantly about how would you want your mom and dad to be treated.
Well, I think it's extraordinarily important that we connect not only to our patients, but connect to each other. This is not only about patient-centered care, but it's about employee-centered caring. Our Patient-Centered Care Committee and bringing it all together, that truly is the entrepreneurial body that moves this model forward. They come in and they light it up. They make it very exciting.
The way our Patient-Centered Care Steering Committee is designed is that it's around the components of patient-centered care. So the importance of sleep, the importance of wellness, the importance of spirituality, surroundings, healing environments, interactions between staff and patients. This group comes together and really talks to other members of the steering committee about what they've accomplished, or things that they've established as goals around these proactive components for personalized, proactive health and healing. And what's key about the steering committee is the interdisciplinary staff. We have staff that represent unions. We have staff that represent the front line. We have leadership teams. We have veterans. We capture all of the perspectives at this one committee and focus on these proactive components that are very important to veterans.